And welcome back, everybody. You're watching News Channel 3 Live at 9. It is a medical condition that is not commonly discussed, but can be quite painful if left untreated. Of course, we're talking about varicose and spider veins.
Oh, that's right. Some women and men suffer with their legs hurting, cramping, restless legs. Many times these procedures are easily done and can be covered by your insurance.
Dr. Jon Roberts is with the Memphis Vascular Center, and he's here to explain how the treatments work. Doctor, welcome to Live at 9. Glad to see you this morning. We typically think of this problem with varicose and spider veins just being a problem for women, but we're saying this can be a problem for men as well.
Oh, absolutely. The patients could basically be divided into two types of patients, cosmetic or medical. The people with spider veins, typically that's cosmetic and that's not going to be an insurance covered procedure, but varicose veins are quite common and most commonly do have symptoms: pain, swelling, restless leg syndrome, and that typically is a procedure that we get covered by insurance.
What does a spider vein turn into a varicose vein, or are they two totally different things?
Well, it's all in the same disease spectrum.
Okay.
But
which is vascular problems in
general? The varicose veins typically are related to superficial veins, like the saphenous vein that they use for bypass surgery on your heart, and it's due to faulty valves. So the blood is dependently, when you're standing up, allowed to, by gravity, fall back toward your feet. So it has to go somewhere, so it develops enlarged normal veins, which turn into varicose veins. Spider veins are kind of a similar phenomenon. They're related to a little bit different class of veins, but treated differently.
Do they typically come about during a certain age range? I mean, once you get over 30, 40, 50, 60, when do they usually happen, or it doesn't really matter these days?
Well, certainly with spider veins, I think as you age, typically people will get some spider veins. I mean, you see them commonly around the ankles and on the feet, and with varicose veins, a lot of times it's genetic. I mean, I've had patients 20 years old with varicose veins.
That young?
That young, yeah.
When do you know that it needs treatment from a medical perspective? Well,
again, that gets back to the patient. The typical symptoms with varicose veins are worse at the end of the day, because as you're up walking around, that blood's allowed to pool.
Do your feet hurt? Your legs hurt?
The typical patient will tell you their leg feels heavy, achy. It feels better when they get home and are able to prop their foot up. There's usually some swelling associated with it. A common thing that's associated with varicose veins is restless leg syndrome. People will complain at night they just can't get their legs comfortable in bed, and so
that's disrupting sleep.
Absolutely. Wow. And then at the end of the spectrum, you see people who develop ulcers on their legs that just won't heal because they're constantly under the pressure. And
really?
Yeah, so it can be a debilitating process if allowed to go unchecked for too long.
Sounds like we have some pictures now. We'd like to show you some before and after pictures. So, doctor, with all of this in mind, how soon should a person go to the doctor to be treated? How soon should they have everything looked at?
Well, I guess when you go can somewhat be dictated by your symptoms. If you're not having symptoms, and just because you have varicose veins doesn't necessarily mean you need to get it treated.
But is it easier to prevent damage later if you have bad enough veins that you know as a doctor that you will be going down this path? I mean, is it easier to treat if you do it early or no?
Well, not necessarily.
Okay.
I think that if somebody is 70 years old and has varicose veins but has zero symptoms, I'd say if they're not bothering you, I probably wouldn't worry about treating it.
Let's talk about the treatment itself, though. How time-consuming is it these days? What about the recovery? Kind of break that down for us, doctor.
Okay. Well, for me, the most important thing is getting a good diagnosis.
Right.
And I'm an interventional radiologist, so my background is in radiology, which the way we diagnose varicose veins and the causes is ultrasound. And so, usually when the patients come to see me, we spend about an hour with the ultrasound diagnosing, because there are a lot of different veins that can cause the problem. It's not just one vein. So you have to do a detailed search and diagnose the problem. once we've diagnosed the problem, we know what kind of therapy we can have to offer. Typically, that's going to be either a laser ablation of the vein that's causing the problem, or if it's not a vein that we can use the laser on, we can inject it with a chemical that chemically ablates the vein.
Wow, so none of this stripping that we used to hear about that could lay people up for a long time.
Yeah, very few cases do we do actual strippings. We will do an occasional, after we've treated the cause, we'll come back and remove the varicose veins, which is, I guess, technically a stripping, but that's the old-fashioned.
After you've done.
Yeah, and we don't do that unless we really need to, and that's usually cosmetic.
So are you usually, doctor, back on your feet pretty quickly? Does it take a day or two, a week or so, or?
Well, when you come in for if you come in for a laser ablation, you're usually in our office for a little over an hour, and that's it. The procedure takes about 25 minutes. We put you in a compression stocking that you wear for a minimum of a week. I usually tell people, depending on how bad the varicose veins are, to wear them longer, maybe 4 to 6 weeks. But no, we want you back up walking that day.
I like that.
Well, it sounds like the difference then is in the diagnosis, so having a radiologist on board where you can really see inside.
Well, I mean, there are other specialties that treat, but I think that, you know, the thing that we have to offer is a unique background in the ultrasound arena so that we can make a good diagnosis.
All right, Dr. Roberts, thank you very much.
All right, information on your screen. If you suffer from these kinds of symptoms, maybe your restless legs are caused by veins.
The folks at the Memphis Vascular Center.
All right.
All right.